That is because Yohimbine works best when your body fat is already low and you are trying to target those stubborn fat areas like the lower abs, hips, and glutes. But the most important thing you must understand about Yohimbine is its effect is completely suppressed if you take it after eating or even between meals when insulin levels are high. When insulin is elevated, Yohimbine simply stops working. So to get the full effect, you must take it in a fasted state. In this video, we are going to break down everything you need to know about the famous fat loss agent, Yohimbine. We'll cover its history and medical usage, how it exactly works in the body to promote fat loss, as it has a very unique mechanism of action. We will also talk about its application during cutting phases, including dosing, duration, and when it should be used. We'll cover its great synergy with other specific compounds to maximize the fat loss process, and of course, we'll go over the key mistakes people make that completely ruin its effects. So by the end of this video, we'll have a clear understanding of how Yohimbine really works and how it can be properly implemented for fat loss purposes. So let's start first with the history and medical usage of Yohimbine. Yohimbine was originally discovered in the bark of a Yohimbe tree, which grows naturally in Central and West Africa. For many years, the bark was used in traditional African medicine, mostly to boost the sexual drive and to increase vitality and energy. Later on, scientists isolated the active compound from the bark, which is now known as Yohimbine. Medically, Yohimbine hydrochloride was first used to treat erectile dysfunction because it increases blood flow and stimulates the central nervous system. It was prescribed quite commonly before drugs like Viagra came to the market. However, over time, researchers started noticing another interesting effect. Yohimbine also increases adrenaline and noradrenaline activity, which can help a lot for fat loss. That is why it became so popular in the fitness and bodybuilding world during cutting phases. So let's first understand the mechanism of action of Yohimbine in the body before we jump into its application directly. Yohimbine can be found in two different forms. The first one is Yohimbe bark extract, which is basically a powder form of the bark that contains some Yohimbine. And the second one is Yohimbine HCL, which contains the extracted molecule of Yohimbine combined with hydrochloric acid. So it is a more refined form of Yohimbe bark extract, and it is better to use because Yohimbe bark extract is not accurately dosed and we only need the Yohimbine itself without the other components. That is why in fitness and bodybuilding world, when people talk about using Yohimbine for fat loss, they refer always to Yohimbine HCL. Yohimbine HCL belongs to a group of compounds called alpha-2 adrenergic receptor antagonists. Now, what does that even mean? To make it simple, let's first understand what the adrenergic system does in your body. As we discussed before in the Clenbuterol video, the adrenergic system is the one that responds when you are under stress. Like when a lion is chasing you, you are basically in a fight or flight mode. Your body releases adrenaline and noradrenaline. These hormones tell your body to release stored energy, mostly from fat and glucose, so you can use it for fuel during stress or activity. Now, there are two main types of adrenergic receptors in the body, the alpha receptors and the beta receptors. Beta receptors like the ones Clenbuterol activates. To be more specific, Clenbuterol mainly activates beta-2 receptors, and generally, these promote fat burning and energy release. But alpha-2 receptors do the complete opposite. They act like a brake system. When alpha-2 receptors are active, they slow down fat release. So what Yohimbine does? Yohimbine blocks the alpha-2 receptors. It basically removes the brakes, allowing your body to keep releasing stored fat for energy. That is why Yohimbine is considered a fat mobilizing agent. It helps your body release more fatty acids into the bloodstream. But here is one important thing you have to know. Yohimbine only works effectively when insulin levels are low. If you take it after eating when insulin is high, it will completely block the fat burning effect. That is why Yohimbine is best taken in a fasted state, ideally before cardio. Yohimbine also have a great synergy with caffeine because caffeine works as an alpha-1 receptor antagonist, which further increases the release of adrenaline and noradrenaline. It basically also removes the brakes, allowing your body to keep releasing stored fat for energy. So combining Yohimbine with caffeine is a great idea to block the alpha receptors completely, and it can be even more effective if combined with a beta-2 agonist like Clenbuterol. A good analogy for that, when you take a beta-2 agonist like Clenbuterol, it is like pressing your foot on the gas pedal, but at the same time, your other foot is still on the brake pedal, which represents the alpha-2 receptors. But when you add Yohimbine and caffeine, it is like lifting your foot off the brakes, so you can drive faster because Yohimbine is an alpha-2 receptor antagonist and caffeine is an alpha-1 receptor antagonist. I have to mention also Yohimbine increases heart rate and blood pressure because it boosts the release of adrenaline and noradrenaline. That is why you feel more alert when taking it. But just like any stimulant, Yohimbine comes with its own list of side effects. And how strong they are really depends on your personal sensitivity to stimulants and of course on the dose you take. The most common side effects are increased heart rate, elevated blood pressure, and that nervous or shaky feeling. Some people describe it as being too wired, like having too much caffeine or pre-workout. That is because Yohimbine strongly stimulates the sympathetic nervous system. It raises adrenaline and noradrenaline, so your body stays in the fight or flight mode for a while. If you take a high dose, or if you combine it with other stimulants like caffeine or Clenbuterol, these effects can get much stronger. Other side effects can include anxiety, sweating, restlessness, and insomnia. And for some people, it can also cause nausea or that lightheaded feeling. I have also to mention there have even been incidents of death because of Yohimbine usage, especially at high doses like 20 milligrams or more, as Yohimbine can raise blood pressure and heart rate in a very significant way. So never start with a high dose if you decide to use it. Always begin very low and see how your body reacts first. So people with high blood pressure, heart problems, or anxiety disorders should avoid Yohimbine completely. Before we move into Yohimbine application, if you have found any value in this video, please hit the like button, subscribe to the channel, and turn on the notification bell so you don't miss any of the upcoming videos. And now, let's talk about Yohimbine application in bodybuilding. Yohimbine is not a year-round fat burner. It is a tool that should only be used during the final weeks of contest prep, usually the last 4 to 6 weeks at most. That is because Yohimbine works best when your body fat is already low and you are trying to target those stubborn fat areas like the lower abs, hips, and glutes. But the most important thing you must understand about Yohimbine is its effect is completely suppressed if you take it after eating, or even between meals when insulin levels are high. When insulin is elevated, Yohimbine simply stops working. So to get the full effect, you must take it in a fasted state. The ideal time to take Yohimbine is 30 to 60 minutes before fasted cardio. That is when it reaches its peak level in the bloodstream, and that is when it is most effective for fat mobilization. Its effects can last around 3 to 4 hours. So taking it once before your morning cardio is more than enough. Don't split the dose, take it all at once before your session. And honestly, if you are not doing fasted cardio, it is better not to use Yohimbine at all, because it simply will not be effective when insulin is present between your meals. For dosage, I always recommend starting very low, around 2.5 milligrams. Then you can slowly taper up if needed, maybe up to 5, 7.5, or 10 milligrams or more. As I mentioned before, combining Yohimbine with caffeine is a great idea. Caffeine helps mobilize more fat by blocking alpha-1 receptors and enhancing the effects of adrenaline and noradrenaline. So the combination of Yohimbine and caffeine before fasted cardio can be very powerful, especially during those final weeks when you are pushing for the last bit of conditioning. But remember, Yohimbine will not do anything if you are not following a proper diet and you are not in a caloric deficit. It is only effective when all the basics, diet, training, and cardio are already in place. It just takes your condition to the next level when you are already very lean. And now, let's talk about the availability and supply of Yohimbine. Yohimbine is widely available and easy to find. In general, Yohimbine is also a very affordable compound. A single bottle can easily last an entire prep. You can get it in most supplement stores, and of course, it is sold by many online shops as well. It usually comes in capsule or tablet form, most commonly in doses of 2.5 milligrams 5 milligrams or 10 milligrams per capsule. You can also find it in pre-workout formulas and fat burner blends, but I always recommend using pure Yohimbine HCL on its own, so you can control the exact dose and avoid unnecessary stimulants or components. It is important to mention that the legal status of Yohimbine depends on the country you are in. In many countries, it is sold freely as a dietary supplement available over the counter. However, in other countries, Yohimbine is actually classified as a prescription drug. That is because it affects the nervous system and blood pressure, so it is more tightly regulated. As we mentioned previously, there are two main forms of Yohimbine: Yohimbine bark extract and Yohimbine HCL. Always go with the Yohimbine HCL. It is pure, without any other components, is standardized, and much easier to dose correctly. But before you decide to use it, I would think first about beta-2 agonists like Clenbuterol, as it might be just enough to get you shredded, or even stacked with Yohimbine for maximum results. So, click on the video to learn more about Clenbuterol.